We are the upper arrival level where passengers disembark as soon as they get to KIA. So on this wing, we have 3 aero bridges. We have C4, C3, and C2. So let's use this boarding bridge as the first point of the arrival formality. So obviously, once the passengers get through the bridge, we board them in barges. So let's say we can do it in barges of, let's say, 20. So before they reach here, there's a customer service person here who will announce to all the passengers on the bridge to ensure that they have all their nose masks on. We have sanitizing stations at the bridge, just at the exit of the bridge, so that passengers will use it to sanitize their hands before they get to the terminal. And also, as you can see, we have social distancing markings on the wall, so that at least we announce to all passengers to observe the 1 meter social distancing. So we board them in barges. So if, let's say, passengers are supposed to disembark on this concourse, as part of the new protocol, all arriving passengers on this level would turn on the left, because they'll have to proceed to the end, to the extreme end, and that is where the bank facility is set up, so that at least they will make payment, and after payment they will proceed to have the COVID test.
But we're told that they're supposed to pay as part of before they embark from wherever they are coming from. That's not, is it just for those who do not do it, or now you're just taking it from here? As
part of the protocol, before you fly to Accra, it's mandatory that you have a negative PCR COVID status. So because without that, the airline will not even board you. And as the president said, every passenger who lands at KIA will have to be tested. So you need PCR negative certificate to board, and once you arrive, you undergo the mandatory test.
Started with these protocols at our airport with regard to the Frontier's healthcare situation. So this morning we're delving into that conversation concerning the contractual agreements, what has been said, what has not been said. And after we are done with this piece that was put together by MFA APAO, we'll be interacting with one of the members of the NDC's minority side to find out what the status quo is and what the situation likely should be moving forward. Do enjoy the rest of this with MFA APAO.
Which you have to pay and take before you continue the arrival formality.
Okay, so once they disembark, they leave them in batches of 20 then they take the left. Then where do we go?
All right, so we proceed. They walk to the far end. We have desks here for passengers who are not able to complete their migration forms, so that at least they can use the desks to also fill their forms. So all arriving passengers on this concourse will walk straight to the far end, to the extreme end. And also, as part of the protocols, passengers are advised or encouraged to fill the health declaration form online, because previously they were given to them on board. But now Port Health, Ghana Health Service, they've come up with a new portal. It's online, so that we encourage them to fill this online before they get to KIA. But at the far end, we have tablets. We have about 10 tablets with internet ready, so that at least in case they weren't able to fill the form online, they can use those tablets to fill before they make payment at the bank.
Okay, so that form is just for the medical records?
Yes.
And then what else?
It captures your passport details, your seat number, because the reason why they need it is in case maybe a passenger tests positive, then they can use your seat number to do the contact tracing. Yeah, so we'll go there and we'll go through the portal and you see all the menus.
Is that what was in place?
No, previously it was manual. They just give them the cards on board to fill.
How would you say this will help in terms of the contact tracing? How efficient has it been?
Yes, because this system is also integrated with your bank payment and also your testing. So they'll give you codes so that at least it's integrated. So it makes it easier if, let's say, you are tested negative, that makes it visible to even track you. So, and it captures all the necessary details, your passport number, everything, the biodata of the customer. before you get to Port Health to get your result. They use that same system to even check whether if your results are in.
Okay.
Yeah.
So we didn't mention that we're still giving the masks, because we're told that once they disembark, they're giving new masks in spite of them wearing one.
Yeah.
Okay, so that's still in place.
Yeah, sure. Okay. Sure. So we've arrived. So all arriving passengers will proceed to the far end. And that's the tablets, which is internet ready for passengers to use to complete their forms.
And all this was put in place by the Ghana Airport?
Yes, in collaboration with Ghana Health Service. So all these tablets are internet ready, and if you can zoom in, yes, you can fill it in English or French. So the passenger, yes, after this, they sanitize their hand. That's why we've provided sanitizing stations on my right. Okay, so.
So my first name is Emerson. Okay, and then my last name is Apollo. Right, I'm female.
Sure.
You're female. My date of birth, okay, October.
No one can keep the year secret to yourself.
Oh, that's fine. So it's supposed to be 12. Okay, I'm showing my October.
No.
I have to change. Okay.
So
do we have people on hand to help anyone?
Yes, anytime flight touches down, we have customer service officers and also some Port Health officials here to assist passengers to complete these forms online. Okay. And also because we have Wi-Fi at the terminal, if this place becomes too occupied, we encourage passengers to connect using their phones through our Wi-Fi, and we give them the website address to connect. And the address, about, I would say 10. Okay. We have the same setup on the other side of the arrival hall.
Right wing,
yeah,
and then the
left wing,
okay.
yeah.
So after I fill this form,
then you submit, then you proceed. But after this, you need to sanitize your hands. Then after, we proceed to make payment at the bank.
Okay, so at this point, I'll just sanitize, and then
okay,
we can move on to the next level then. Okay, so it has a sensor as well.
Yeah.
Okay.
All right. Okay. So as you can see, you have floor markings so that these passengers in the queue will observe the social distancing protocol. Yeah.
So from here, then we're moving.
From here, we proceed to the bank to make payments.
Okay. So this is where we pay the famous $150. Yeah. So you get tested. I don't have $150 just yet, and I didn't arrive from anywhere, so I don't get to pay at this point.
Just go through straight. I think there are some passengers who are making payment.
Okay. How fast is the process? Because convenience is such a big issue for many.
Yes, one of the things we've put in place is that there is this online portal that passengers can even pay online before they get in here. That makes the facilitation very, very quick. Okay. But they have about 8 or 9 teller units, and they ensure that at least passengers don't spend more than 5 minutes at the bank.
There are some passengers, thankfully, but I don't know how receptive they will be, so we can tell if they can testify that the process has been very fast. But that's for another day. We'll get to interact with them. Yes.
You can pay by Momo, you can pay by POS.
Okay.
And also you can pay by cash.
And as you can see, we have some passengers there going through the process. They've just arrived and going through the process. So from here, then what happens once you pay?
Proceed to the testing unit. I think we can go through, right?
Yeah, we can.
Sorry, excuse me.
Sorry.
Sorry, excuse me, please. Thank you. Madam, please put on your nose mask for us, please. I would appreciate if you have your nose mask on. And these are the protocols that we enforce at the airport.
How difficult is it?
Oh, so far, so good. I mean, majority of passengers are complying, yeah. And it's not only passengers alone, also stakeholders of the airport. It's mandatory that every user puts on his or her face mask on. So. All right, so that's the bank. So immediately you make payment. Then you proceed to the testing unit or the testing center.
So you have a receipt or something?
They'll give you receipt and everything. We have 35 booths, 35 cubicles, and also 35 on the other end, making 70. And each cubicle has, let's use this. Each cubicle has a desk and a chair for the passenger to sit down comfortably. So before the passenger gets here, there will be customer service people here to allocate the passengers to empty booths. So we have 35 booths here and also 35 at the other side. Sample taking doesn't take more than a minute. So as soon as the sample is taken, then the passenger proceed to the port health side. Yeah.
And wait for the result?
No, I mean, once you get to the port health side, they will undergo temperature screening, and by the time they get to the Ghana Health Service desk, their results are ready. And they should expect their results within 30 minutes. Yeah, 30 minutes.
All right. So I'm sure we'll just move.
So we finish taking our sample, then they will continue walking to the other end, as you can see.
And all this, we're hoping that will be done within 30
Within 30 minutes, you get your results. And also your results can even pop up on your phone because your email address and everything is captured as part of the formality.
Because you fill the biometric
Forms and everything. So your email, your status, once you check on your phone, you can get SMS on your status. Yes. So after taking the sample, you will not use this lane because this lane is for arriving passengers who are going to make payment at the extreme end. And this phase is for passengers who have already completed their sample.
Okay. So it doesn't really matter where you're coming from. You're all paying the 150.
Yes, sure.
Okay.
And this is how they look like. I mean, passengers sit there, they have all their items ready, and sample taking shouldn't take more than a minute.
Okay. Great. Thank you.
Okay. Thank you. So that is one of your customer service people that ensure that passengers are allocated to empty booths.
Okay. Okay. Do I get an allocation? I haven't paid 150. Okay.
And also, once the samples are taken, at the back end, the medical people ensure that they move all the samples to the lab. And this is an enclosed lab. Only authorized personnel are allowed inside. So this is where they do all the checks. And by the time you get to the port health section, on the ground floor, low arrival, your results should be ready. Yes.
Okay. So by the time you are done, you finish, they take your sample, it goes in here, then you go out to the Port Health Authority, you continue the
immigration process.
And then by the time you're
get
done,
get there within 30 minutes, your results should be ready.
Okay.
All right. So let's proceed. I mean, let's go through the Port Health side.
Okay.
And I'll show you the new systems that they've put in place as part of temperature screening.
Okay. You're taking a grand tour of Terminal 3 today.
So the same setup, we have the same on the other wing of the...
okay, so like you said, another 30.
Another 35 booths.
Okay.
Same, we have another bank and also the same setup here, there as well. Okay, so we've arrived. So taking our test, we are now going to the Port Health section to undergo temperature screening.
So from here, let's go and then take our temperatures and then we'll get back to you on that.
So on this floor too, we've made available sanitizers so that at least passengers can use it to disinfect their hands once they're on this floor. Okay. All right. Okay. So we are at the lower arrival level of the...
Back where we began.
Yes, back where we began. So here we have queue systems here. So the passengers will go through, and as you can see on the floor,
okay.
The lower arrival section of the arrival hall. This is where passengers will undergo the temperature screening at the port health section. And by the time the passenger gets here, within 30 minutes, the passenger should get his or her results. So they go through the queue, and as you can see on the floor, we have social distancing marking so that these passengers would adhere to the safety protocols that we've outlined at this section.
We have 5 of the markings
at each point. So the passengers will come and stand here, and now the port health temperature screening is automated now. Previously, it was a bit manual. They use handheld guns to check temperatures. But now it's more automated. The camera can scan about 10-15 passengers on the spot. And as you can see, the temperature is displayed on our forehead. So what it does is, as part of the preventive measures, your temperature shouldn't be more than 38 degrees. So passengers will have to just go through, and they will pick only passengers whose temperature goes beyond 38 degrees. Yeah.
What's our temperature now?
I can see your temperature now, Jifa, is about 36.4. So you're safe. No, maybe once it's above 38, then they'll do some clinical assessment. Yeah.
Okay.
Because it's not all high temperature that is COVID. So they have health officials there, and they will clinically assess you.
It doesn't appear anybody can escape when it comes to...
And it captures all your image. It captures everything. So it beeps, or it gives a very high indicator when passengers whose temperature exceed 38 crosses the line. So it's there for you to see, and it captures data. Everything is saved in a database. So here they'll pick their results as they undergo the temperature screening, and immediately they get the results, they proceed to immigration. Yeah. Yeah. Both, yeah. Yeah, temperature screening. Yeah. Once we are done with this, we proceed, pick up your results, then we go to immigration.
Protocols that we put in. But you are sure that this is very fast, very convenient, no waste of time at the airport when you come?
No, within 30 minutes you should expect your results and you proceed. But if you are in case positive, then they will put you aside. The health officials will clinically assess you.
Where do you put the person aside?
Okay, they have quarantine rooms here. And also they've set up other offices here where psychologists and team of doctors will be available so that they will clinically assess you and they will take a decision.
The quarantine room is around this area?
This side, yeah.
Okay, all right.
And we also have some offices there for some psychologists and doctors.
And thankfully, nobody has had a chance to use it just yet.
No. So far, as I'm aware of, there isn't any positive passenger yet.
Okay. That's interesting. So that's the way it looks like here at the Terminal 3 now in terms of the safety protocols that has been put in place. And Mr. Prempe has taken us through the processes. We've been up there all the way down here. We don't have any issues with immigration at this point. So we'll let it go at this point. But I've seen an Emirates flight coming in. The last time it was announced where the flights were trickling in. So this is the latest?
Yes, Emirates started operations today. And this is their first maiden flight ever since the borders were open. Yeah.
And I'm checking the time. This is just about 5.
5, yeah.
So you are now getting into your peak season for the day?
Yes, we are now preparing for British Airways. We are expecting about 260 passengers arriving tonight. And we are going to use both wings of the upper arrival to ensure smooth passenger facilitation.
Still in batches of 20?
20, yeah. So we coordinate with the airlines and we bite them in batches of 20s. And passengers arriving must ensure that they've completed the health declaration card. The website address is https://ghs-hdf.org/hdf. Once they go online, they can fill it anywhere before they arrive, so that at least facilitation process becomes very smooth.
Mr. Prempeh and your team, thank you so much for this brief but interesting tour of the Terminal 3 in terms of the safety protocols that have been put in place. But the audience still have questions. Once they bring up the questions, we'll bring them to you. And thank you so much. And keep up the good work. And stay safe.
Sure.
Stay safe.
Sure. All right. All the best.
Thank you so much, sir.
All right.
Great. Thank you.
Okay, so
Just do a stand up in
just
front,
stand
then
by.
we are gone. I have to go and prepare for tonight. Mr.
tonight.
Papa will be in the studio.
Hope that was insightful for you. Thank you for staying with us on the AM show. That was my colleague Emefa Apau with that revealing piece from last year. This was when, the processes had been initiated at the Kotoka International Airport with regard to what people would do when enplaning and disembarking as well. But then there arose the issue to do with Frontiers Healthcare Services Limited. And that's why this morning we're having this conversation. The contractual agreements, the sort of processes that were followed, and where we find ourselves now, even in terms of the cost of testing. What are the latest developments, and what, for example, has the minority in Parliament been pushing for? We're joined now over the phone lines by Honourable Member of Parliament for North Tong. I'm talking about Okujeto Ablakwa, who this morning has been gracious enough to give us some of his time. Honourable Ablakwa, a very good morning to you, sir.
Hi, good morning, Mr. Kaku. How are you doing?
I'm doing very well. It's a great pleasure to have you. I know this morning you're participating in the vetting and all of that, but we're grateful that you've agreed to speak to us. Thank you so much. Now, let's start from here.
Always a pleasure.
We've heard different things. In fact, we've cited different documentation with regard to the Ghana Airport Company Limited reaching out to the FDA because they are a part of the process when it comes to healthcare and whatever, logistics will be used, like what Frontiers Healthcare is doing, the PPA, among others. But let's start from this angle with regard to the testing so far. From what you've seen delivered by Frontiers Healthcare, what is your reaction? What is your appreciation of what they've done so far? Does it meet what you were expecting individually and maybe as the minority in Parliament?
Well, so good morning to you and good morning to all our distinguished viewers. First of all, we would want to stress that the matters we have been raising about Frontiers Healthcare Services and how they came about this contract to carry out antigen tests at the airport is nothing partisan, it's nothing personal. We don't have any vested interest apart from doing our job, our constitutional mandate imposed on us as a group in Parliament that is expected to carry out oversight and to ensure that the necessary checks and balances are pursued so that the right things will be done in our country. So this is purely pursuing our constitutional mandate. It is purely ensuring that our duties to carry out oversight is pursued without fear or favor. And we have been sounding the alarm bell from last year when we came by information that the way and manner that this whole arrangement was put together, it's not in the national interest. It's not transparent. There is no accountability. It falls way below the standards and the threshold that the laws of this country expect of a contract of this nature. Virtually all the laws that we pass in Parliament and that everybody is expected to abide by, all those laws were broken in the process leading up to Frontiers Healthcare Services being given the airport antigen test deal. So what are those laws? First of all, we discovered that the Public Procurement Act was not followed. The Public Procurement Act has provisions, if you look at Section 41 of the Act, has provisions where in emergency situations, where there's a catastrophe and all of that, you can use single sourcing and you can expedite the process to, as it were, respond to the catastrophe as the law uses. The law uses that expression, catastrophe, or in times of emergency, Section 41 of the Public Procurement Act, as amended in 2016. All those provisions were not followed. Our checks at the PPA, and we are not surprised that so far, all of those who have responsibility over public procurement. Remember that when we asked Godfrey Dame, the honorable nominee for Attorney General, who wears too hard, by Article 88.1, he and his boss at the time were supposed to be principal legal advisors. They said they were not asked to advise on this matter. The PPA governing board, the Honorable Godfrey Dame, served on the governing board. He tells us that he's not aware that this contract came before them. And we know for a fact, based on the investigations we have carried out, that the PPA was not involved. They didn't follow due process so far as our public procurement laws are concerned. So
okay. So Honorable Ablakwa, let's get into that a bit. I just want you to give pause a bit. Are you suggesting then that we are basically, with the Frontiers healthcare situation, it's an illegality that is in place? Because we've cited the documents from the PPA as well, citing Act 663 and indicating that they did not have oversight over some of these matters. And so to speak, the Ghana Airport Company Limited could go off, but on a limb, and that they were not directly involved in this situation. So what exactly is the dynamic there? If you say it is not in the national interest and it was illegal, so to speak, what exactly do you mean then? Why do we then have this situation?
So I have told you about Section 41 of the Act, which should have been followed in times of emergency. Because in any case, the airport was closed, remember, on the 22nd of March.
Right.
It was not until September the 1st that the airport was open. Between March, April, May, June, July, August, September, from 7 months, nobody can convince me that we didn't have enough time to follow through with the law and to follow through with systems. So the PPA law was grossly violated. The second law, the Fees and Charges Act, requires that any public service provider, any agency, any ministry, department or agency, MDA, that is going to levy the general public, you must come to Parliament with an LI. Parliament must approve those charges. This exorbitant, this punitive, this cutthroat $150 did not come to Parliament.
But the sum has been reduced now, hasn't it? For ECOWAS, members, it has been reduced.
After an ECOWAS resolution, and even that the ECOWAS resolution said that for PCR tests don't go beyond $50. What we are doing at the airport is an inferior antigen test.
Right.
And if you look at the world rate, at the time we were charging $150 for this antigen test. Malawi was charging $25. Malaysia was charging $28. India, the Goa airport, $28. India, the Via Savaka International Airport, $7. Heathrow Airport in the UK was charging $70. If you come to the more expensive PCR test, comparatively, at the time we were charging $150, and we are still charging $150 by the way, for non-ECOWAS nationals. Togo is charging $80 for the more superior PCR test. Sierra Leone is charging $80 for the more superior PCR test.
So the question to be asked, Honorable Ablakwa, then is, if we could have...
$28, Germany $70,
right.
Turkey $16
right.
for the more expensive PCR.
So the question...
are broken.
The question...
The other law, the third law, and this perhaps is even more important, more fundamental to this, because we are talking about public health. You see,
right.
we should put this whole thing in context. It's about our lives. It's about our biodata. You are taking samples. You are purporting to protect us. How can we be sure that if you are breaking all the laws, matters to do with compliance, quality assurance, how can we be sure that the whole arrangement at the airport is not even a sham? Especially now that we are being told by the scientists, the experts, that the UK variant is what is dominating the current wave, this second wave that we're experiencing in Ghana. What should convince anybody that what you even put out at the airport, what you are doing there, meets standards, there's quality assurance, and that it is not just a money-making vehicle. Now, right. I was going to that third law, which is so important.
Okay, very quickly, so we move on to other matters and wrap up.
Which is the Health Institutions and Facilities Act. Very, 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 very fundamental. If you look at Section 11 of the Health Institutions and Facilities Act, it says that you cannot operate any health facility, any biomedical facility, without a license. Frontiers Healthcare Services operated from the 1st of September all the way till they got a license on the 3rd of November. The health minister told us, the health minister, or former health minister, now health minister designate, told us at the vetting that it was when his attention was drawn months after that he assisted the company to get a license from HEFRA, the Health Institutions and Facilities Regulatory Authority. The question is, this should have been done prior. The license must be secured before you commence operation, because this is about human lives here. It's about a pandemic.
So the processes, that was a clear breach. But let me just quickly find out from you. So the $50 fee that is being charged now, is the minority still upset with that? Would you want it to be pegged lower than even the $50 that we are currently having to pay?
We are absolutely upset about it. We take the view that the Fees and Charges Act should be respected. This is a country of laws. We are not a banana republic. This is not a jungle where, the same people who were justifying $150 say that because of the investment they have made, that they cannot go below $150. Then ECOWAS passes a resolution, and you are able to come down to $50.
What would you propose by way of a sum? By way of testing, what would you propose? How much?
This arbitrariness must stop. They should come to Parliament with an ally. Let's do things properly. Let's do things properly.
So before that is done, what would be your proposal, Honorable Ablakwa, in terms of cost? What would be your proposal?
Look, this claim that the Frontiers Healthcare Service, and by the way, Frontiers Healthcare Service has absolutely no track record. Remember that this company was incorporated only on the 21st of July.
But they are tied to a global company, biotech.
They have no track record. Frontiers has no...
And I'm saying they have ties to a global company which deals in some of these things.
Look, we have capacity. Ghanaian companies. We have Ghanaian research institutions. No Gucci could have done this. KCCI could have done this. We could have supported them. The solution they brought is on the shelf. You just buy it in the open market, and we could have built indigenous capacity than this very, very labyrinthine structure with an account in the Dominican Republic and all of that. It doesn't.
You've still not given me a figure. Are you able to give me a figure that maybe you can stand by as a minority that that would be a more appreciable figure when it comes to what people should pay for this COVID testing, especially as it's an antigen testing.
I have told you that for antigen tests, look at what Malawi is doing at $25, Malaysia $28.
So the minority is going by $25.
Some countries, Italy, for example, their government has subsidized. Now it's even free. You see, during a pandemic, you require a humanitarian mindset, not a profiteering mindset. That is the problem here. Our leaders see this as an opportunity to make money, to fleece people who are already dying, who are inconvenienced, who are struggling. This is a humanitarian catastrophe of monumental proportion. We cannot be thinking about how to make a quick buck, how to just break the laws and profit from the misery of our people. This is a pandemic that has killed over 2.4 million
and that is something that the minority has said time and again. But let me also find out from you very quickly, was there any breach in the sort of processes that were initiated from the start? Because per the information we have, it was actually Frontiers that reached out to the Ghana Airport Company Limited to trigger this entire process, offering, so to speak, their services to the GACL. Is that the reverse in terms of procurement of services of what should have happened? Should it have been the GACL, for example, reaching out?
So, yeah, there are occasions that some of these contractual arrangements begin unsolicited, where people approach those in authority and say that, look, we have a solution or we have a proposal. But you see, it should be subjected to transparent processes. Even after you've received such proposals, you should first find out, you yourself as an institution or as a country, what do you want? What do you want to do? And it should be by your terms, because it is at the end of the day, it is a public office you are occupying. You are there representing us. It's not just about your personal interest, and it shouldn't be about the private person who is, because if you are just open, and people always, the businessman will want to make supernormal profit if you give in, if you open the floodgates. So I am not impressed so far that all the questions we keep asking, simple questions. Where is the contract? Nobody has it for us. What are the terms? Who signed the contract? Nobody is telling us anything. We are told that Frontiers made investment. How much? And the solution that Frontiers provided. How come that now in Ghana you can go to places like Aka House, go and do an antigen test for 200 cedis, and other places even far less? You have all kinds of antigen tests all over the place. Now in the international market, if you look at the prices, between $4 and $16, the most expensive.
So Honorable Ablakwa, what are you going to push for as a minority on this, to wrap up? What are you going to push for in terms of the pricing? Is there anything you're going to table on the floor of Parliament? Should we expect anything from the minority?
About a month or two ago, I made a statement on the floor demanding a parliamentary probe. I think that application is still before the Speaker. That is something we will pursue. We are also hoping that during this vetting process, we may be able to elicit the right answers. We so far have been very, very elusive. Yesterday, the Minister Designate for Information pointed us to the Transport Minister nominee, that when he comes, hopefully we may get the answers we are looking for. So we're looking forward to that. But remember that is the latest twist in what has been a comedy of many, many twists.
Right.
The health minister initially had told us that it's the Presidential Task Force. When we pointed out to him that, look, the Presidential Task Force is not an entity under the Procurement Act, then he says, working with the Ghana Health Service. Then his former deputy, Dr. Okoboy, told your network that it's Ghana Airport Company. Remember that 2 days ago, the chief advisor to the president on procurement, the Honorable Adjasafo, pointed us to the finance minister. Yesterday, the information minister is pointing us to the transport ministry, which, by the way, at the time this bill was being consummated, aviation had been hived off, and aviation was not part of the transport ministry. So I'm only hoping that he doesn't come and also continue with the chorus of I'm not aware.
Let's see what will happen from there, and we'll be looking forward to seeing what the minority, based on what you tabled on the floor of Parliament, will be doing. But I'd like to say a very big thank you to you, Okudzeto Ablakwa. Thank you for joining us this morning on the AM show. Honorable Okudzeto Ablakwa is the Member of Parliament for North Tong, and he joined us on this conversation. More we can expect from there. But before we delve into some legal matters with regard to the election petition, which is coming up next, I'd like to wish a very happy birthday in advance to Maria Abba Lovelace Johnson. You are Chief Regulatory Officer and Head of the Food Enforcement Department with the FDA. Maria, this is a very happy birthday being wished to you in advance by Ekosam and all your children. Do have a wonderful birthday. Do stay with us. We'll be right back with the next conversation.